Welcome everyone. Good morning, good afternoon, and if you're in Sweden or elsewhere in the world, good evening. Um, my name is Melissa Walls, and I'll just say briefly, it's a pleasure to introduce our guest webinar speaker today. I'm coming to you today from Anishinaabe or Ojibwe territory in Minnesota. Memengwan Indishinakas, Magizi Duodam. I am a co-director of our Center for Indigenous Health at Johns Hopkins University, and we are so grateful to get to offer these webinars now and then where we get to learn and be in spaces with other Indigenous people and allies across the globe. You know, most of our webinars are Turtle Island specific, North America specific, but today we get to hear from one of our Sámi relatives who's in northern Sweden. So I'll share that Dr. Petter Stoor is a Sámi and Swedish licensed clinical psychologist and researcher. He was born and raised in the city that many of you might know of as Kiruna, and I understand I'll probably mispronounce this, but in Sámi, Giron, and is from a Sámi reindeer herding community in Arctic Sweden. And I had the honor of getting to run into Petter at a conference in Norway this spring, and looked up some of his work and what a prolific writer you are. Everyone I meet seems to know you, seems to have run into you at different conferences. And so we are so grateful to have you here in this space. And with that, I'm going to go ahead and hand it over because we want to hear from you today, Dr. Stoor. So I'll hand you the mic. Welcome, Miigwech, thank you. The floor is yours.
Thank you very much, Melissa. I'm honored to be here. And it's a great pleasure of mine. Really look forward to it. It's always great to connect, I think, with other Indigenous health researchers and people working on similar topics from other parts of the globe. And certainly that was the case when meeting you in Norway in the NISA conference this summer. So I'm just thrilled to be able to share some of the work I've done and some of the work that we're doing and hope to be doing as well. I think I sent you this perhaps a little bit a bit over ambitious quote. This is what I'm going to say, and I've tried to come up with slides that can kind of match that, but let's see. My topic of today is equity for Sámi people too, focusing on health, public health, a little bit, especially mental health, perhaps among Sámi in Sweden. As you said, Melissa, my name is Petter Stoor, or as I would say in Northern Sámi, if I can change my slide. Pikku-Nilsa Ánde Biehtar. My name is Petter Stoor, or Pikku-Nilsa Ánde Biehtar in Sámi. For those of you who may know Northern Sámi or maybe Finnish, you know that Pikku, that means tiny, really small. So my grandfather was Nilsa, the tiny. My father was Ante, and I am Petter. So I'm a grandson of a tiny person. And of course, if you know Swedish, the pun is that stor means grand, like great. So it's a little word game there. I come from northernmost parts of Sweden. I grew up in Kiruna and outside Kiruna, Giron, and as part of the Lavas Cerro, the Lavas reindeer herding community. You see a family picture of mine up there to the right. That's Pikku-Nilsa sitting on a sled. That's likely sometime late 40s, 1940s, somewhere up the Kalix River Valley. So that would be furthermost north in Sweden. Maybe if you know this will be the area with the highest peaks in Sweden, then the Kebnekaise Mountains. And that's where my Sámi family belong. And of course, should I have had a Sámi mother, I could also have introduced myself along the matrilineal line. In this case, my mom is from southern Sweden, so I'm Swedish and Sámi. But in this case, of course, it makes sense to introduce myself from the Sámi side of the family. Mainly, I've worked with Sámi mental health topics in Sweden, in Norway, in Scandinavia, in Nordic countries, and also somewhat across the Arctic with mainly suicide and suicide prevention issues, I would say. Those are at least my fields of expertise. Now, the last couple of years, more moving into public health. And this is also where we kind of start this journey. First, I want to share with you this quote we are Sámi and we want to be Sámi without therefore being neither more nor less than other peoples of the world. And so this is a quote from a famous Sámi quote from the early 70s, when kind of the Sámi movement woke up and the revitalization of Sámi culture really started. And I think this connects to the theme of equity. And you can have it in the background and see if we can somehow come back to this quote later on in this journey today. First, a little bit more about Sápmi. Sápmi are the traditional homelands of the Sámi people. You see there on the map, Scandinavia and the Kola peninsula in northwesternmost Russia. So these are the homelands of the Sámi. So Sámi are not necessarily indigenous, for example, to all of Sweden, but to the northern, mid and northern parts of Sweden. There are, I think, 9 Sámi languages spoken today, of which 5 are spoken in Sweden, mine being Northern Sámi, which is the largest Sámi language today. Estimations say that we are maybe 17,000 individuals or something like that, speakers of Northern Sámi. And the smaller languages, some of them have just 20 or 30 or maybe 40 speakers. So some are really endangered, some are endangered still. In Sweden, Sámi ethnicity is very closely connected with reindeer husbandry, but that is because of Swedish legislation. Sámi have subsisted on many ways that you can subsist in the northern parts of Scandinavia. So that includes hunting, fishing, small-scale farming, and reindeer herding, of course, as well. We really don't know how many Sámi there are, and I'll come back to that, but at least 20,000 in Sweden for sure, and maybe up to 40, 50,000, but we don't know how many would self-identify as Sámi. And Sámi have been recognized as an indigenous people in Sweden since the late 70s, and are also now acknowledged in the Swedish constitution as the second people of Sweden. So the Swedes and the Sámi are the 2 recognized peoples in Sweden. And Sámi we have democratically elected body representing us in Sweden, the Sámi parliament, or Sámitikki. Right. So how come we don't know anything about the Sámi demography in Sweden? Well, the last census that included Sámi ethnicity in Sweden was done in 1945. And by the early 70s, the Swedish government realized that, okay, we really don't know how many Sámi there are, and an investigation is needed somehow. Calculations were made based on the number of individuals having connection to reindeer husbandry. As I said, there is a tight association between reindeer husbandry and Sámi ethnicity in the Swedish case. And mid 70s, there should have been around 17,000, maybe 15 up to 20,000 Sámi in Sweden. And they did a prospective judgment saying that probably there'll be around 20,000 Sámi around the year 2000. And still, in 2024, we say that there are about 20,000 to 40,000. So we're still using a prospective number from a governmental investigation done in the mid 70s, still 40 or 45 years later on. So it tells us something about the lack of knowledge around these very basic demographic issues, which is of course also then connected to how we can research Sámi health, etc. And I'll come back to that. But how come this then? Why is this the case? Well, as I said, Sweden does not conduct censuses anymore. Instead, we have quite highly developed population registers, actually really, really good data in our population registers, but they do not include ethnic markers or identity markers in that sense. Also, since Sámi are a minority population all across the Swedish Sámi territories, it really doesn't work with geographical proxies. Maybe there are about 10% Sámi in my hometown of Kiruna and somewhere around that in similar places. And these places will be there, the places where we have the highest Sámi population density in Sweden. So it's hard to know really. And the reason behind that is, of course, connected to the Swedish Sámi history. Here we see a Sámi artist, Katarina Piiraksikku, using one of the tools that racial biologists used in the first half of the 20th century, trying to prove, using these kinds of tools, that Sámi were somehow an inferior race. And so the memories of these racial biology investigations are still living among Sámi. And of course, this is also then connected to the war, the Second World War, with the atrocities of the Holocaust, which were also somehow fueled by these racial ideas. And after the Second World War, Sweden abandoned registering ethnicity. I don't think this has been discussed in Swedish official reports, but here we have some quotes from the similar events happening in Norway after the Second World War. So here is a quote from the Statistisk Sentralbyrå, that would be Statistics Norway, about how they kind of viewed the topic of race and perhaps also ethnicity, then saying that since we cannot no longer determine what race people belong to, and also due to the discrediting of race due to the wartime circumstances, as they say, we don't count people's races anymore. Sámi in Norway objected to this. So in 1970, in the last Norwegian census, Sámi were included in some parts of Norway. So Sámi did not approve of this being somehow removed or made invisible in the national statistics. I don't know if there were similar things going on in the Swedish Sámi case as well, but this tells us something about the discourse surrounding ethnicity, race, Sámi ethnicity, etc. in the Nordic countries. And today, neither Norway, Sweden, nor Finland register Sámi ethnicity in the population registers. All those things are beginning to change, especially in Norway. And of course, this affects us. The Swedish and the Scandinavian societies are run on data, they run on statistics. So the same governmental report that made this prospective analysis about the number of Sámi in Sweden also said that the lack of population data on Sámi complicates long-term planning, at times even making it impossible. And that was already in the 70s, and this situation hasn't really improved. And as you can see, they also argue that in the national registry, all people are equal, meaning that we don't count race. Of course, that will heavily impact a small minority like the Sámi. But the Swedish government saw this as being equal, not counting race or ethnicity. And this situation, as I said, it has gone on since then. So here we have some quotes from the UN Special Rapporteur Paul Hunt, who visited Sweden in 2006. So he was the Special Rapporteur on everyone's right to the highest attainable standard of health. And he calls out Sweden on this very issue without data disaggregated on the grounds of race and ethnicity, specifically talking about or referencing Sámi people. How will Swedish authorities know if there is a problem connected to health among the Sámi? How can they devise appropriate interventions? And how can they make sure that things are working if they try to do something about it? So this is really a kind of a core issue connected to Sámi and Sámi health research and what we know and what we can know about Sámi health in the Swedish and also in the other Scandinavian countries as well. And the fact of the matter is that we have quite limited evidence. This is a quote coming from a report, a series of scoping reviews I did in 2015, 2016. Focusing on psychosocial health, so mental health topics, similar topics. And the conclusion was that we lack evidence to say something certain or definitive about Sámi health in Sweden connected to mental health and psychosocial health. There are similar scoping reviews focusing on somatic health, saying similar things like there are so extensive knowledge gaps regarding the state of somatic health. Especially in Russia, Finland, and Sweden. Norway is better, not because of registering ethnicity, but because of spending on health research. But so this is the context. And this treat everyone equal principle, if we call it that, I think it shapes the discourse in Sweden. So we have this, on the one hand, limited knowledge about Sámi health outcomes, usage of health services, etc. And this is also connected to other things. So Sámi have no right to speak Sámi language in contact with health services in Sweden. There are no designated resources or structures investigating Sámi health topics in Sweden. There are no Sámi-specific ethical review systems, and there's really no formal way for Sámi to influence what goes on, because some things are happening, of course, within the context of free academia, free researchers investigating this and that topic out of interest. So curiosity-driven research, that is happening. But there's no formal structures for influencing what kinds of topics. Sámi priorities aren't necessarily prioritized. So, and it's connected again to this idea of treating everyone equal, how that is the kind of the governing principle, and the understanding of that as making registering ethnicity hard. And so, of course, it becomes very hard for Sweden to live up to or reach the goals of, let's say, the Swedish public health policy, which is to minimize the avoidable health inequalities within the next generation. So high goals, but very hard to reach unless you are able to focus on specific groups like ethnic groups or indigenous groups in Sweden. And here, I think it makes sense to actually jump across. Let's visit Norway briefly, because Norway as a country is very similar to Sweden in many, many ways. Governmental structures will look the same. They also have a Sámi parliament, for example. So a great many things are very similar, but some things are different. And from a Sámi perspective, this is really clear. For example, here you see some quotes from the Norwegian Sámi law saying that in Norway, you do actually, as a Sámi, have the right to use your language in contact with health services. There is more knowledge available on Sámi health in Norway because, as I said, of expenditure. Social and health services shall be adapted to Sámi linguistic and cultural needs. The Norwegian government is spending on welfare system actors to try and improve Sámi social health and health outcomes and rights. For me, as a university-based scholar, researcher, and educator, it's interesting also to note that there are specific things happening in Norway connected to that. Already from the 1960s, there are, for example, designated seats in medical programs for Sámi-speaking students. So trying then to make sure that Sámi have access to Sámi-speaking physicians, doctors, nurses, etc. That is not the case in Sweden, despite, for example, the fact that where I am based now in Umeå, at Umeå University, this is the northernmost medical university in Sweden, and it was actually founded in the 50s and 60s because of the need to ensure northern Sweden had access to trained doctors, nurses, psychologists, etc., dentists. Still, we don't have this focus on making sure that Sámi have access to people who are knowledgeable about Sámi culture or Sámi language. And also, interestingly, Norway has a Sámi-specific ethical review system and guidelines for Sámi health research specifically. And that is based on collective consent, so principles established by the Sámi parliament in Norway. And as I said, we don't have this in Sweden. So to the extent that we have something or a normative system, we follow the Norwegian guidelines, which as it happened, I was part of formulating those. So I think those are great, but tells us something about the lack of systems for ensuring good practices in health research, focusing on Sámi topics in Sweden. So back again to Sweden. I think what we're trying to accomplish, me and my colleagues in this Sámi health group that we call Lávvuo, which is the Sámi name for the nomadic tent, I guess similar to teepees. what we want to do is we want to challenge this treat everyone equal principle through research. And we've actually, the last couple of years, we've been successful in negotiating commissioned research projects from the Swedish state. So the Swedish government has commissioned us to do 2 reports, one focusing broadly on public health among Sámi in Sweden, and one focusing more specifically on exposure to violence among Sámi women. And while I think this is really positive because it shows that this treat everyone equal principle, it's actually negotiable, and we can get a more equity-based understanding included in there, and then be able to reach the national Swedish health policy goals as well. However, I don't think it's a coincidence that we are seeing the focus being placed on mental health, suicide, which is the kind of the core of the public health project, and also on violence against Sámi women. These are kind of vulnerability issues or topics where Sámi health can be seen or construed as inequity and vulnerability. We're not getting grants to look at things where Sámi may be better off, or kind of the strengths connected to Sámi health, only about the vulnerability issues. And that, I think, is problematic in a way, because it directs our gaze only to vulnerability and less to strength. But let's take a little bit closer look about what we've found in these commissioned reports. Oh yeah, first this. What we did to be able to do these reports was basically we tried to create a system capable of monitoring Sámi health through research. So what we did was use the administrative registers that were available, that we thought there was a high likelihood of Sámi people being included in them. So for example, the Sámi electoral roll, people eligible to vote in the Sámi elections to the Sámi parliament, and these should be self-identified Sámi, but also administrative registers connected to reindeer husbandry. So for example, people who had income from reindeer husbandry, and through using those administrative registers, we were able to find around 10,000 individuals, adult individuals, who should have a very high likelihood of being Sámi. And so that was our workaround in creating an ethnic register for Sámi health research purposes. However, I should mention that we did this within the context of first communicating with the Sámi parliament in Sweden, saying that we think we can do it this way. Do you want us to? And we won't go ahead unless you agree. So we tried to ensure this collective consent, that we had that support from the Sámi parliament. And we also communicated that for us, this was not a one-time thing. This was something that we wanted to realize as part of a system. So making sure that we could do this again and again. And as you see, we're envisioning this to happen every 4th year, collecting self-reported data on Sámi health topics. And also doing register-based studies. That's our plan, although we haven't gotten as far ahead in that. But in the end, the Sámi parliament very much agreed with this. The understanding perhaps before doing this was that no, we're not registering ethnicity, and that is because the Sámi are so vulnerable, and we shouldn't do that. It's dangerous. Sámi parliament had no problem with us doing this, but of course it happened in the context of us asking their permission, saying clearly that we won't go ahead with this without your permission, etc. So it happens also in this context of self-determination, and they want to see this data produced. So in the end, they commissioned us. So in the end, we acted on behalf of the Sámi parliament when collecting our data. And so this is our data set that we've used for those 2 reports and that we're using in most of our work. About 3,500 individuals. To our knowledge, this is the largest Sámi data set collected since the racial biology era. So for the last 60, 70 years at least, that we have a Sámi specific data set. As you can see, we have a little bit more women than men, and we also have some other response biases in our group. On the other hand, we have a population frame, so we can account for that. So data that I will show you are weighted so that it should be representative for the about 10,000 individuals that we were able to include from these administrative registers. So then let's have a look. How is Sámi health compared to Swedish health? Because we used a lot of questions very similar to questions in the Swedish National Public Health Survey. That was also part of the idea. So if we first take a look at somatic health indicators, here we see the number one line will be the Swedish national population and how they rate these issues, these indicators. And then we have the prevalence ratios for the Sámi and the confidence intervals. So when this line crosses the number one, we don't have statistical certainty of differences. Sámi reported worse or more obesity and more overweight, but this is self-reported, so based on self-reported weight and length. Sámi reported more allergy and asthma, quite a bit more allergy and asthma. Sámi reported more inconvenience of pain all across the body and also more chronic ill health. Sámi also reported less commonly reported good dental health. So, and these were our core indicators for somatic health. And to the extent that we're seeing some patterns here, clearly Sámi seem to report worse somatic health compared to the Swedish norm, the Swedish population in general. If we then take a look at some more lifestyle indicators or behavioral health indicators, you could also say, we see some more, bit more diverse picture and a little bit more positive. Sámi consume less cannabis. Sámi also have less risky alcohol consumption patterns. Sámi also smoke less than Swedes in general. Sámi use way more snuff or smokeless tobacco. If you're familiar with the Scandinavia, you know this. It's way less dangerous tobacco than smoking, for example. So it's maybe this is positive, but Sámi use it way more, and it's way more used also in northern parts of Sweden. So likely our data here is also a kind of an extreme northern Swedish pattern that we're seeing. Sámi also have less good dietary patterns, consume less fruits and vegetables, drink more soda, eat less fish, for example. Oh, that one should actually have been green because it's good to be less sedentary. So Sámi are less sedentary than Swedes in general, perhaps reflecting of having less office jobs, for example. So that one should have been green. But again, more obesity and more overweight. If we then look at my specific topics of interest, so mental health, we also see a bit of a diverse pattern here. For quite a bit of our indicators, Sámi reports better mental health outcomes, so less sleeping problems, less problems with fatigue, less psychological distress, and slightly more psychological well-being. However, Sámi also reports quite a bit more suicidality, both suicide attempts and suicide ideations. And I think this is really interesting, and we can have a lot of hypotheses about what is going on here. My hypothesis is that to some extent, I think we're seeing cultural response patterns here, or response patterns that are influenced by culture, and our questions connected to suicidality, suicidal behaviors, those are more direct, more clear. Like, have you ever tried to take your own life, for example? People know if they've done this or not. Our questions connected to psychological distress, they are more about norms, values, things like that. So I think those may be a little bit more sensitive to kind of cultural norms. And my understanding of Sámi cultural norms is that you should be a stoic, you should be hardened, you shouldn't complain, etc. And I think to some extent we're seeing that kind of pattern here. But This is a better picture than I imagined I would be looking at when doing this research. So that in general, it's positive. As I said, we've also taken a closer look at exposure to violence. That is not as positive. Here we're seeing data on self-reported exposure to sexual, mental, and physical violence among Sámi women and women in Sweden in general. So the Sámi data is the darker shade here. Sámi women do report more exposure to psychological violence and physical violence than Swedish women in general, and that also goes for Sámi men. However, there's no difference in sexual violence exposure. But if we look at the specific indicators, I'm not showing those here now, but if we look at the specific indicators and look at the severity, for example, attempted rape and rape, where we are seeing Sámi women reporting more of that than Swedish women in general. So there are nuances in here as well. But the exposure to violence indicators, I think those are among the biggest concerns of ours. And also, as I said, suicidal behavior. And when we look at risk factors for suicidal behavior, we're also seeing exposure to violence stand out, both among Sámi women and Sámi men, as a key risk factor for reporting suicidality among the Sámi. We're also seeing some kind of more common social determinants. So among Sámi, both men and women, younger age is related to reporting suicidality, relative poverty is associated, economic vulnerability is associated, but also exposure to violence. Interestingly as well, among men, lack of Sámi language proficiency is also associated to reporting suicidality, and it is actually about a strong indicator of suicidality or risk factor for suicidality as exposure to violence. So not being able to speak the Sámi language seems to be as detrimental to reporting suicidality among the Sámi men as actually having been exposed to violence. And that brings us to the topic of language and what language can mean for health. And we've taken a closer look at that. So here you're seeing data on just comparing within the Sámi group, those that can speak Sámi and those that cannot speak Sámi. So the Sámi speakers in green here. And there you have also our key indicators for mental health problems and suicidality. And as you can see, there's a clear pattern here that those Sámi not able to speak Sámi language, they do report more or worse mental health outcomes. They more often report suicide attempts, suicide thoughts, mental distress, depression, worry, anxiety, stress, and lack of mental well-being. And these are statistically significant even when controlling for the most common social determinants. And for us, this is a really important finding because quite a big group of Sámi cannot speak the language. In our data set, it's about 20 to 25%, 22, 23% who are able to speak the Sámi language. And if this is a key resource for having good Sámi health, which I think we have good reason to assume, that also would mean that if we're able to revitalize Sámi language, and in turn Sámi culture, that would also mean that that's a key resource in making sure that Sámi have good mental health. And this is actually one of our things that we want to focus more on in the future, and I'll come back to that briefly in just a sec. But if you just look at our take-home messages so far, I think that in general, Sámi health is comparable to Swedish health, at least when we're looking at self-reported health. And I don't think that we're seeing large inequities like we're seeing in some other indigenous contexts. I think it's fair to assume that the strong welfare systems in the Nordic countries are the things making the difference here. So Sámi are enjoying good access to strong welfare systems, and also likely this treat everyone equal principle has also been a key driver for good health among Sámi in that sense. However, since Sámi specific social determinants and Sámi health rights specifically aren't addressed, including, for example, use of Sámi language. There is also indirect push towards assimilation. So you will be able to get these good resources that the Nordic societies does provide for their citizens. But at least in the Swedish case, it's also included that you kind of have to have to become Swedish. And to some extent, I think Sami, perhaps in a greater extent than some other indigenous peoples, are able to do this. Because if I weren't wearing my traditional clothing here, probably I would look just like your everyday Swede. So if I just didn't speak the language, I just didn't dress like this, I just kind of hid away everything Sami with me, chances are that I would be able to integrate really, really well into Swedish society, and most Sami do this. But of course, that comes at a cost. And I think that is what we're seeing here. So Sami are able to trade in their identity, their ethnicity, their language, cultural values, etc., for good access to Nordic welfare systems. But we're also seeing this, I think, when we're looking at specifically mental health topics, or at least that's what I'm finding. When talking to Sami, for example, about what do you think about suicide among us? What do you think is causing that? They do talk about how Sami are not able to maintain Sami identity, how they're seeing suicidality as something that is coming out of this. So lots of issues connected to identity, and lots of issues actually also connected to reindeer husbandry, as that is very central, very important to Sami identity in Sweden. And we're seeing quite a bit of pressure on these traditional livelihoods within our current capitalistic system, where they are in conflict with much more stronger other kind of stakeholders using the same land. So for example, forestry companies, mining companies, wind, hydropower companies, other kinds of societal infrastructure, railroads, raids, tourism industries, all of these things challenge Sami reindeer husbandry for the same land. And that is making reindeer husbandry less and less viable as a livelihood. And that is also within the Swedish context. We have one study looking at suicide mortality, and what stands out there is that Sami reindeer herding men have died more often than comparable groups in northern Sweden. So it is very likely that something is happening there as well, connected then to indigenous identity and being Sami. So where to next? Well, we are still here. And I think the key resources that we have been able to find in our data connected to culture, I think that is the key for us. Of course, also keep building this system, keep working with Sami stakeholders, the Sami parliament, non-governmental organizations. We're trying to work with them in a nothing for us without us way. So for example, I'm doing my postdoc at the moment. I'm doing that together with the Sami National Youth Organization. And we want to be able to produce health data that Sami then are able to use in advocacy work, and also be able to show this connection between cultural survival really and health. And our data shows that there is a strong connection there. And I think our next step will be to, within the Swedish context, look at what are these cultural survival strategies that Sami are using, because they are still here. What are they doing? How are they doing this? Remember again that Sami, in no place in Sweden will Sami be in majority. There's going to be no municipalities where Sami are governing. They all be a minority anywhere they are. So it has to be about what they do in their everyday lives, in their families, in their smaller communities. It's something there that kind of makes the Sami identity live on, the language, the culture, the values, etc. And what is that? That's a key thing of interest for us. And in doing so, I think we really can learn from other indigenous contexts where you've been researching these kinds of topics for a way longer time than us. And I think for me, that's what's interesting also with hopefully working with you, Melissa, and with the Center for Indigenous Health in at Johns Hopkins, and trying to look at maybe learn from what you're doing, but also maybe compare, because maybe we also have things to bring to the table, so to speak. But that's what I hope will happen in the future. And then when we do that, we're able to look into more of, because it's not only about language, it's all about cultural values as well, and lots of other things connected to being a Sami that may also be good for health. And then we come back to this quote that we started off with in the beginning. Equity is about being able to maintain your identity and how that is connected to health. And I think this is what was envisioned when they talk about this, because they said this quote in the context where equity or equality was seen as I've tried to explain to you in the Swedish and Norwegian Swedish context. Equality was also about Sami having to hide away their identity. Equity means being able to show who you are and maintain that lifestyle, if you will. However, some things that may happen if we do this, if we continue along this path, is that we should be expecting things like this. So here's a newspaper quote when we last year released our data, and I became the poster boy of the fat and happy Sami, to great amusement for my kids. But I can live with this. It's better to be fat and happy than other things you can be. But yeah. All right. Thanks for taking up the time, and thank you for listening to me. I'm happy to take questions if you have any.